Okay, this is a book review. Here's the book. It's called The Hidden Epidemic. The author's name is Thomas Levy. He's an MD, JD. He was a cardiologist, so actually quit working as a cardiologist. And this book has kind of both extremes. In some ways, it's a great book. In other ways, it's a stupid book. He also sells supplements, so he's biased, and he's going to recommend selling his special version of vitamin C. I don't like that, but there's other things I like about him. He kind of does think between the lines amongst different fields. Very few doctors do that. I'll tell you some of his ideas in here, and he had written another book previously about vitamin C that I thought was very good. He had summarized all the studies on vitamin C and all the great health benefits it had provided. And Linus Pauling was no dummy, okay? He had showed a lot of benefits from vitamin C, and then they later on went back and did all these studies to discredit his work. But I can tell you this always happens. Whenever somebody comes along and shows that something that's cheap, you can't patent vitamin C, then they discredit their work. So I actually believe that intravenous vitamin C is probably a much, much, much more powerful good medicine than is widely realized, because it's a powerful antioxidant in the water aqueous space. Plus, it can rejuvenate, vitamin E in the plasma membranes. It can reactivate glutathione. So I really wish there was some independent research facility where you could get the true answers on these things. The reality is all these famous research centers, they all stink. I've never seen one that was worth a crap, because they're all focused on making money, not on helping the patient. And most of the time, the best thing is just free observations. I'll go into some of that some more in this talk. But again, it's the same old story. You need to educate yourself, because you can't rely on the conventional medical system. It's not out to help you. Its goal is to make money. It doesn't care about you. As a matter of fact, the billionaire perverts hate your guts, and they tend to own almost everything. Okay, Thomas Levy. Infected teeth, tonsils, and gums cause the vast majority of heart attacks and breast cancer. Now, upon first hearing that statement, you would say, he's crazy, he's an idiot. But then you'll say to yourself, well, why might somebody say that? Okay, then he says, chronic apical periodontitis, meaning an infection at the top of the tooth in the jawbone, can be asymptomatic and painless. It is extremely common. Sometimes it can be diagnosed only by X-ray or CT. CT shows it a lot more than does a plain film X-ray. He says in 78% of 101 patients presenting with myocardial infarction, heart attack, and occluded coronary arteries, the DNA of pathogens, bacteria, typical for CAP, chronic apical periodontitis, and root canal treated teeth, were found in the occluding blood clots after they were aspirated out of the coronary arteries by angiographic access, meaning transcatheter access. So what is he saying here is they went into the heart of the people having a heart attack and they sucked the clot out, okay? And then they sent the clot to the laboratory where they did tests to check for the DNA of bacteria, and they found it was in 78% of the bacteria. So he's saying he thinks the bacteria are causing the heart attacks. I don't. I'll explain why in just a moment, but I want to tell you about one more study. He says another study examined the tissue from 38 coronary artery disease patients after atherectomy. That's again transcatheter removal of atherosclerotic plaque. And they found bacterial DNA in all of them, 100% of the specimens. In control specimens from autopsy, they didn't find any bacterial DNA. All right, so why do I think this is not the cause? I'll tell you why. Because if the bacteria were really the main cause, then how did Esselstyn and Ornish and Armstrong and McDougall and Pritikin and all these other doctors, Kempner, cure all these patients with coronary artery disease? If bacteria were the problem, they weren't doing anything to treat bacteria. They were just giving them low-fat diets, low-fat, low-sodium diets. So I don't think the bacteria are the primary cause. What I think is happening is the bacteria, atherosclerosis is a blood clot, and the bacteria they eat it. How do you culture bacteria in a laboratory? You culture them on a blood agar plate. They eat blood. So I think they're floating around in the blood due to leaky gut, leaky gums, and the bacteria is just a free meal. They're like, hey, free food, let's eat it. That's what I think is going on. But there's a second theory. If you talk about leaky gut, we talk about leaky gut before. I give entire lectures on it, why it is prothrombotic. Because the bacterial endotoxins get into the blood. LPS from gram-negative bacteria, LTA from gram-positive bacteria. So LPS is lipopolysaccharide, LTA is lipoteichoic acid, and those bacteria then can be catalytic, autocatalytic with fibrinogen. They change its shape from a cylindrical secondary protein structure of alpha helix, they change it to beta pleated sheet. Beta pleated sheet can stack up and form hydrogen bonds between the molecules. The larger the molecular weight of a molecule in aqueous substance, the more likely it is to precipitate, which means to clot. So the bottom line is what I'm saying is bacterial endotoxins cause clotting. And just like you can get them from leaky gut, you can get them from leaky gums, you can get them from infected teeth. And you get a cavity, it'll drive its way down through the enamel, through the dentine, through the pulp space, and then come out at the bottom of the tooth, at the bottom of the root, called the root apex. That's why the root apex is called apical. And around it is called peri. Odont means tooth, so periodontal abscess or periapical abscess. I see these every day on CAT scan. I look at them all the time. They're super common. So they do have a point. Osteomyelitis of the jawbone, the mandible on the bottom, the maxilla on the top, is super common. Okay, so I do think they're onto something. Okay, I can also tell you I've looked at many thousands of brain damage patients with cognitive decline, memory loss, dementia. And, there was a comedian, his name was Dice Clay, and he was vulgar, jerk, okay, fine. But he did have one thing that he would always say, like that he would have sex with almost any woman, he said, you just give me 2 tits, a hole, and a heartbeat, and I'm there. Okay, and I know that's very vulgar, but let me explain what I'm getting at. I look at these demented brains, and I say, what do they all have in common, okay? And almost always, what I see is an atrophic brain, and then I see cataract surgery, quite often 2 cataract surgeries, at least 1, but very often 2, okay? And then the next thing is I see a hole. And I see a hole, what I mean is I'll see they usually have no teeth or they have bad teeth with periapical abscesses. So what I think is all of these things are related to the same process, the same diets and habits that cause atherosclerosis, coronary artery disease, hypertension, and diabetes. They also cause dental tooth decay very often, and they also cause cataract. Dairy is especially associated with cataract. Okay, hypertension, diabetes associated with atherosclerosis, devascularization of the teeth, impairment of the immune system, with results in progression of dental infections. Okay, and people might have a root canal for many years and tolerate it okay, but become more fragile as they get older and immunosuppressed due to their chronic generalized debility, and these infections will then progress. So I can tell you though, I can guarantee to you that poor teeth dentition is strongly associated with cognitive impairment of the brain. And this guy Levy, he would say dental does you in. And I do think that is something that's going on with patients, because I've given lectures recently about how poor teeth and these amalgams and root canals are associated with increased risk of multiple sclerosis, the idea of the veins in the face being in communication with the veins of the brain, so the brain can drain whatever position. If you're sleeping on your right, sleeping on your left, sleeping on your stomach, sleeping on your back, there's always veins that can drain the brain, okay? They don't have valves, flow can be in either direction, and they communicate between the face, the mouth, the teeth, and the brain. The dental toxins, like the anaerobic bacterial toxins, they're able to cross the blood-brain barrier. Same thing with mercury toxins, okay? So they have the ability to cross the blood-brain barrier. They have direct access. And that guy, Patrick Storterbrecker, the Swedish guy, he thinks that the beginning of MS is more of an infection inflammation than it is a primary demyelination process. So why am I going through all this? Because the characteristic lesion of multiple sclerosis is periventricular hyperintensities, let's say on a FLAIR or a T2 weighted sequence, meaning there's edema there, okay? And they're right next to the ventricles. Well, what do I see in all these demented brains? A lot of them have a clean brain with no periventricular FLAIR or T2 hyperintensities, but I do see tons of periventricular T2 and FLAIR hypertensity. That means abnormal water, edema in the brain next to the ventricular system. And we can't always explain them. Okay, we can say, oh, it's chronic small vessel atherosclerotic disease, ischemic disease. But we don't know that. We can say, well, maybe we think it's, transependymal CSF leaking out of the ventricles in the context of, like normal pressure hydrocephalus. But we can't explain that. And a lot of times I don't see any other manifestations whatsoever of NPH, normal pressure hydrocephalus. So what I'm saying is Levy might be right that there is a contributor to brain damage due to all these dental infections, and no one's aware of it. Because what happens is dentists only know the mouth, the teeth. Regular doctors say the mouth is none of their business, that's dental territory, and they don't learn anything about it. I was a neuroradiologist, and despite even being a neuroradiologist who looks at the teeth all day long every day as part of my job, all we sort of look for is there an infection, yes or no? We're not thinking about the teeth in association with other diseases. I gradually became aware, gee, lots of these patients with sinusitis, especially when it's unilateral, suggesting a focal cause, they very often have a periapical tooth infection or a tooth protruding up into the sinus, okay, with unilateral disease. If it's bilateral, it might be some type of allergic sinusitis, for example. But I'm just telling you, I always look carefully at the teeth when I see an ipsilateral sinusitis, all right? So let's continue with more things that Levy was talking about here. He says, if you have one or more root canal treated teeth, you have an increased risk of heart attack. And again, is that because of the tooth, or is it just because those same patients tend to be diabetic and hypertensive and fat? Okay. Increased oxidative stress is associated with increased all-cause mortality. So oxidative stress just means you have more oxidants, pathologic bacteria, for example, than you do antioxidants. You don't need enough plant food. Okay. What causes increased oxidative stress? He uses the abbreviation IOS for increased oxidative stress. And he says it's electron stealers. And I kind of like what he says here. It's an overstatement, but it still is interesting. He says most pathogens, if not all of them, are electron stealers. They grab electrons, they steal them, and they don't give them back. To steal an electron is to oxidize something. And of course, the classic, most powerful electron stealer in the whole periodic table of elements is fluoride. It's a free radical that steals electrons to complete its outer octet. It wants that eighth electron, okay? So that's a good definition of a pathogen. It's an oversimplification, but it's a good definition. It's an electron stealer. It steals an electron, doesn't give it back. So what's an antioxidant? An antioxidant is an electron donor. It gives an electron, okay? And then the question is, well, how can an antioxidant give an electron and not become damaged itself? And the reason is antioxidants tend to be these really big molecules with lots of double bonds, meaning that they've got resonance characteristics that enable them to stabilize charge even once they've given an electron away. So that's what's unique about them. And then where do antioxidants come from? They come primarily from plants, because the plant's out in the hot sun all day. If you or me were out in the hot sun, we go, gee, it's 100 degrees outside, it's a little bit too hot for me, I'm going to go walk under that tree, go in the shade. But the plant does not have that choice. It stands in the middle of the field, 100 degrees outside, and it has to protect itself all day long from oxidation. So what it does is it makes these chemicals, these antioxidants, that are able to donate electrons and handle the oxidative stress of the intense sunlight. Okay, vitamin C reduces oxidative stress, and he recommends people supplement vitamin C, but like I said, he's biased because he sells it, but he did summarize all the work of Frederick Klenner, which was extraordinary. This is another one of these guys. He's kind of like the vitamin equivalent of Walter Kempner, curing all these diseases all over the place with intravenous vitamin C and high dose oral vitamin C in some settings as well. And I don't think that's all faking. I think there's some reality to it. You know, there was no money involved. I don't believe there was any big money to be made. They just wanted to cure the patients. They just didn't have many options. And then, you know, something like that gets suppressed. So I really wish somebody would do vitamin C. I really wish there was a rich person out there that would, you know, supplement me so I could just do research all the time. That's what I want to do. But you can't get any money for this research. People will tell you, go screw yourself. You know, unless you're working for a big drug company, they're not going to give you money to make something they can't make money off. That's why you need to have Christian ethics to say, well, just do what's right for the patients. And that's why most of the research that gets done in medicine, you could spend $10 billion just trying to make a drug for money, and you'll never find anything worthwhile. They've spent hundreds of billions of dollars, and it's all a joke, okay? They don't come up with anything, you know. Come on, we still can't even cure the same old diseases, you know, since 1960s that we cure in 2 seconds with a low-fat vegan diet: hypertension, diabetes, obesity, coronary artery disease, etc. Okay, let's see what Levy has to say next. He says when a molecule receives an electron, it is reduced. Its valence goes down. When a molecule loses an electron, it is oxidized. Normal cell resting membrane potentials are typically in the ballpark of -40 to -70 millivolts. A diseased cell will have a lower transmembrane voltage. Yes. And cancer cells will have very low transmembrane voltages. That's an interesting statement. It also reminds you, too, when you eat plants, you get more potassium, more magnesium, which is used by the sodium-potassium ATP pump to maintain a high transmembrane voltage. And you start winding down that electrochemical gradient when you don't eat enough potassium and magnesium. So, a lack of plant foods contributes to a diseased transmembrane voltage. Very interesting. The health of a cell can be related to the percentage of molecules it has into the reduced, that means better, electron-rich phase versus oxidized or electron-poor, electron-depleted phase. And this relates to the argument for grounding. So a grounding pad is something that you can have here. I'll show you my grounding pad. I got one on the floor in my room. Hold on a second. One second. I'm going to lift it up. So I don't want to touch it with my hand, but here's my grounding pad that I keep underneath my desk. You put it into the grounding thing on the wall, and you supposedly get electrons from the ground. The reason for that is the ground is electrically negative. So the ground of the Earth has an excess of electrons. And when you stick in a grounding lead, it'll flow up the grounding lead, okay? I gave previous lectures on grounding and all that stuff. I do think there's some truth in it because I know I slept better when I did that grounding stuff. Some people think it's placebo. Some people think it's complicated in a city that you don't necessarily get reliable grounding. But anyways, the Earth is negatively charged, the atmosphere is positively charged, and that gets them to stick together. There's a guy by the name of Pollock, okay? He's the guy who did the research on the fourth phase of water. He just came out with a new book called Charged, trying to explain all kinds of things in the Earth, why we have wind, why the Earth rotates, all based on electrical charge. It's an interesting book. I'm about a third of the way through it, but I kind of got distracted. I had to read more of this dental stuff. I'm going to go back to it as soon as I get a chance. Okay, let's see. Cancer cells tend to be iron overloaded, and they tend to have abnormally low plasma membrane potentials. All that iron around, you get more free iron and causes trouble. It undergoes the Fenton reaction by ferrous redox cycling, Fe2 plus Fe3 plus Fe2 plus Fe3 plus, and that can initiate Fenton reactions with the production of hydroxyl radicals that are very damaging. The same free iron can also cause clotting in the blood because it'll also cause distortion of the blood clotting proteins, fibrinogen, to go from alpha helix secondary protein structure to beta pleated sheet secondary protein structure. So then you get those amyloid clots. So a change in secondary protein structure is called an amyloid transformation, and it causes those to precipitate, which causes them to clot. So that means you got these little blood clots floating around in your blood. And that can plug up arteries in your heart and cause atrial fibrillation, plug up arteries in your brain and cause cognitive decline. And that can contribute to atherosclerosis, congestive heart failure. So there's something to all this. The bacteria getting into the blood can sort of trigger this amyloid transformation of the fibrinogen clotting protein, leading to more blood clots. They typically are the size of 2 to 200 microns, and that can cause, the equivalent to coronary artery disease. Regular coronary artery disease is in the big epicardial coronary arteries, but you can get something called microvascular angina or coronary syndrome X, microvascular angina, plugging up the smaller arteries of the heart, okay? He talks about copper, just like iron, also bad, just tends to cause more oxidative stress. He talks about never supplement with calcium. He thinks it's a disaster. I know high supplementation with calcium, I think over 1,400 milligrams a day, was associated with 2.6 times increased coronary artery disease. So calcium and supplementation is stupid. Okay. He also recommends to keep your serum ferritin levels really low. He likes them in the range of 20 to 30. I've read other papers from pretty reliable sources saying it's best to keep them 30 to 80, which is very low. If you read the books, they'll tell you something in the ballpark, like 100 to 400 is normal, and he says, no way, you want it below that. And there's good reason to believe that you want it below 100. I've seen a lot of papers to that effect. Mine myself had high ones up, getting around 270 or so, and I've been donating a little blood. Not really donating blood, I just pull off a couple extra tubes and discard them whenever I have a blood test, because I want to drift my serum ferritin levels down. To protect myself from oxidative stress. Okay, he says root canal tooth is always infected. You can get an infection in a tooth even with no root canal procedure. Cavity can drive its way down through the enamel, through the dentine, through the pulp space, down through the bottom of the pulp space, out the apex, into the mandible or the maxilla, the jawbone, so to speak, and infect it. Okay, when the pulp is removed, the immune system can never get to the bacteria in the root canal tooth and the dentine tubules. They're always infected. Okay, cone beam CT shows chronic apical periodontitis. That's what CAP means, much better than X-ray does. And I put page numbers on all these, so if you want to look at the book, you can. I got the page number of what I think are the best parts. Okay, we're on the home stretch now for this one. Chronic apical periodontitis is the main cause and aggravator of heart disease, cancer, and most chronic diseases. So, like I said, on the one hand, I think that's bogus because you can cure these diseases with a low-fat vegan diet. But on the other hand, he's got a point that you're forming clots because of the bacterial endotoxins, And then people eat the same diets that are iron overloaded, diabetic, hypertensive. But you're forming clots that are going to plug up arteries in the heart. That's like coronary artery disease. You're going to plug up arteries in the brain. That's going to cause cognitive decline. You're going to make tissue ischemic. That's going to contribute to a Warburg effect, metabolic theory of cancer. So there is some, method to his madness, okay? Chronic apical periodontitis is extremely common and it's usually painless. One can follow CRP, C-reactive protein, in the blood to get an extent of the amount of chronic inflammation. Normal CRP, he thinks, should be described as 0.5 nanograms per milliliter or less. You can get chronic disease from chronic apical periodontitis from a native tooth that's infected, from a root canal tooth that's always infected, and from cavitations, jawbone defects after suboptimal tooth removal, tooth extraction. The main problem with why you get jawbone infections after tooth removal is because they failed to remove the periodontal ligament, the PDL. That's what attaches the tooth to the bone of the jaw, of the mandible and the maxilla. So you have a tooth. The tooth has an outer layer called the cementum that's connected to the periodontal ligament, and then the periodontal ligament is connected to the bone, the maxilla and the mandible, the jawbone. And if you don't remove that when you extract the tooth, it won't heal correctly. You have to remove that in order for the tooth, the jawbone, to realize that there's no tooth above it and it needs to grow more bone to fill the cavity. Otherwise, you have a persistent cavity that tends to have irregularities in it, like an irregularity of the periodontal ligament. It's like partially injured and it'll get infected. Okay, dental surgery should not use local anesthetic with vasoconstrictors because the vasoconstrictors themselves can make the bone ischemic while you're working on the tooth. And that can lead to cavitation formation. When a patient has unilateral sinusitis, infection of the paranasal sinuses, let's say a fluid level, bubbly secretions on a regular CT of the sinuses, always consider ipsilateral, same side, chronic apical periodontitis, jawbone infection. Yep, I was just talking about that. Always do that. Take a look both at the axial CT and at the coronals to make sure you know what you're looking at. And maybe even take a look at the sagittal images as well. IAOMT, International Academy of Oral and Medical Toxicology, have a consent form for root canal procedure. It's in the book, and it's kind of funny because they don't normally tell the patients all these complications, just like they don't tell patients when they go for dental fillings, about the mercury and the potential risk of that with amalgams. He said about 60% of adults who've had a root canal procedure he said about 60% of adults have had a root canal procedure in the Western countries. That's a lot of people. I know tons of people have amalgams. Okay, excess oxidation is the underlying cause of all diseases. I think that's an exaggeration. Most toxins steal electrons. Donating electrons to toxins blocks them from causing disease, so antioxidants block disease. People who are hypothyroid are at increased risk for increased complications for dental infections. Okay, so let's summarize this book. What do I think is good about this book? This idea that when you have a patient who is sick, make sure you consider what's going on in the mouth, especially if you don't have another good explanatory cause, because I think a lot of people miss this. And, never forget Weston Price, perhaps the greatest dentist of all time. He did a root canal procedure on his son who was 16 years old, and his son got a heart attack immediately afterwards, and he thinks the root canal is what caused his son's heart attack. So he devoted the rest of his life to studying why does root canal procedure make people sick. He came to the conclusion is it's always infected, and the bacteria undergo what's called pleomorphic change, transition from being aerobic to anaerobic, and the anaerobic toxins are even worse than the aerobic toxins from the bacteria, and these cause all kinds of disease in the body, both intracranial and extracranial, and it can potentially cause heart attack and potentially cause kidney failure. So the mouth and dentistry is much more dangerous than people realize, and again, I like this idea of, because in real clinical medicine, lots of patients, most patients don't get better, and everybody just gives up on them or starts saying they're psych patients, and nobody ever looks in the mouth. And I would say don't give up on the patient until you've considered toxicology, EMF, EDCs, circadian rhythms, and consider dental problems. Okay, it's a major under-recognized cause of serious disease. So, okay, I hope you found that helpful.